A very good evening to everyone. This is Shubham. Welcome back to my channel Medical Concepts. So now in this video we are going to talk about the helminthiasis and the rickettsiosis. Okay, helminthiasis and the rickettsiosis. So let's move into the topic. You must have talked about this topic in the microbiology. Okay, so we'll be revising this knowledge from the microbiology. Okay, so during the autopsy in the liver was detected a bladder-like formation with flat surface 5 cm in diameter. Okay, great amount of small vesicles with the transparent colorless contents in its cavity. So the liver tissue around the bladder is sclerosed. And what is the most possible diagnosis? If you'll see the question very carefully, they are talking about the bladder-like formation. Okay, bladder is having generally the smoother appearance, isn't it? And flatter surface. That's what I'm talking about. So flat surface, smooth surface. Okay, so 5 cm diameter and small vesicles are there, but remember, autopsy is going on inside the liver, not in the bladder. In the liver, they are talking about that there is a finding of a urinary bladder-like kind of appearance. Okay, so yes, that is the thing which they are talking about, and they are talking about the vesicles. They are the colorless contents over there, small vesicles with transparent colorless contents. That is a typical finding of the hydrated cyst or hydrated cyst of the echinococcus. Yes, echinococcus is that thing which we have talked about in the dog tape form, right? So hydrated cyst is the dog tape. We seen dog tape form, and we used to do the Cassoni test in the microbiology. You must have studied about that. We used to do the Cassoni test, which actually comes under the category of the type 1 hypersensitivity reaction, right? So that is the image of the CT which I have inserted over here, which I'm talking about. So this is the CT scan image. As you can see, the vertebral column over here. So the thing is how to identify the CT. First of all, if you are seeing bones which are coming whiter in color, then this is the CT scan. So over here you can see the ribs, they are actually whiter. Okay, here you can see the liver. Let me mark for you. Here is the liver, and inside the liver what you can find? Yes, this one I'm talking about, multiple cystic cavity, isn't it? Multiple cyst you can see over here. And what is that? This is the yes, hydrated cyst. This is the hydrated cyst. Multiple, these are the vesicles containing the these hypoechoic regions. Hypoechoic means they are darker in color. Hyperechoic will be whiter in color, hypoechoic will be darker in color. So these hypoechoic things which you are seeing over here, let me remove the markings. Yes, this one I'm talking about. So this is what? This is the hydrated cyst of the echinococcus or the dog tape form. So these vesicles are containing the colorless kind of transparent kind of fluid, and that's what we appreciate in the hydrated cyst of dog tape form or the echinococcus, right? So the answer will be very clear in your mind. So that will be the hydrated echinococcosis, right? Hydrated echinococcosis or hydrated cyst. Okay, or hydrated cyst. Okay, moving on to the next question. A patient complained of fever, severe headache, dyspnea and heartbeats. They want to say, I think, higher heartbeats or the tachycardia. Physical examination detected pediculosis, roseola, petechiae on the skin of the thorax, bad sores of the shanks, foot gangrene. The patient died with the signs of the cardiac insufficiency. The heart is not working well, unable to pump the blood. Histologically in the medulla oblongata, they were detected the tissue hyperemia, stasis and the perivascular ferrules of the plasma cells. Okay, and they're mentioning about the microglial proliferation, that is the Popov's granuloma. Popov's granuloma, you must have studied about that. Popov's granuloma is a finding of rickettsia or the epidemic typhus or the scrub typhus, many kind of names. Okay, from the microbiology link, epidemic typhus is called. So answer is very clear over here. They're talking about the Popov's granuloma. They will be finding over here. There is the epidemic typhus or the scrub typhus, or if that is not given in the option, then you can go with the rickettsia or rickettsiosis. Okay, let's move on to the meningococcal infections. Okay, so a 3-year-old child died being in the deep cerebral coma. Autopsy shown purulent thickenings. Purulent means pus kind of formation is there on the surface of pia mater. Pia mater is one of the meninges which are covering the brain, right? Now in fact that is the most inner one. In the frontal parts of the brain, cerebral edema is there, microscopically plethora, okay, and neutrophilic infiltration. If there is inflammation, then definitely neutrophils will be going over there to tackle the situation. Neutrophilic infiltration of the pyometer have been detected on the possible disease over here. So the thing is very clear that they are talking about the cerebral coma where there was purulent thickening and neutrophilic infiltration is going on inside the pyometer. So that is the inflammation of what? Inflammation of pyometer. So can I say pyometer is a part of meninges, so can I say inflammation of the meninges? So meningitis, isn't it? So that we are talking about the meningitis. If they are talking about the pustular purulent thickening, purulent means pus formation. Pus formation, we have already talked about that many times, that if there is pus formation, that is due to the bacteria. If the bacteria is persisting in the meninges, most commonly it has been seen, however, most commonly I am talking about, not always, most commonly it has been seen that this is caused by the meningococcal bacteria. And what is that name of the meningococcal bacteria? Meningococcus bacteria, that is caused by the Neisseria meningitidis. Neisseria meningitidis, okay, this you already know from the microbiology. So here I am talking about which one? Neisseria meningitidis. Okay, listen to this explanation very carefully, because this will be helping you in your infectious disease, because all these things will be coming in the infectious disease again in your 5th course. Okay, so please remember about this. So Neisseria meningitidis is an etiological agent for the meningococcus. Okay, so this is actually causing the involving the meninges and causing the inflammation over there, causing the pus formation over there, sometimes abscess formation over there, and causing the problem. So that is causing the meningitis. So meningococcal meningitis is the term which we use for this bacteria if they're involving the meninges. So here your answer will be the very clear in your mind. So that will be the meningococcal meningitis. So let me talk about the image over here. So meningococcal meningitis, so first one, what is the meningitis? Involving of the inflammation of the all the meninges, right? Meninges, what are the layers of meninges? Dura mater is the most external one, then comes your arachnoid matter, and then comes your pyometer. So here are the images, dura, here are the hints over here, dura mater, arachnoid matter, and the pyometer. So look, so as you are approaching from the bone, like from the skin of your scalp to the brain, so how you will be approaching? First of all, there is skin, then there will be the periosteum, then skin, then periosteum, then bone, then dura mater, then arachnoid matter, and then at last there is your pyometer, isn't it? So if there is involvement of the layers of the brain, that the meninges of the brain, so that will be the meningitis. And if it is having the pus formation, most commonly it has been seen that it is due to the meningococcal bacteria. And which one is this? This is Neisseria meningitidis causing the meningococcal meningitis. Okay, sometimes we have seen that in the pyometer you can see this one, it is having a cap like formation in the pyometer, and this cap like formation sometimes is giving you the color of yellow green. As I said that it is the bacterial inflammation, so yellow green cap formation will be there sometimes, which can be appreciated due to this meningococcal bacteria. So that is the meningococcal meningitis. Okay, so enough about this, let's move on to the next question now. So now they are talking about question number 209. Autopsy has shown a plethoric yellow green. So yeah, yellow green pyometer. Your diagnosis is very clear in your mind already. So in the upper parts of cerebral hemispheres shortened with the purulent and fibrous exudate, they're talking about meningococcal meningitis. Yes, so looking like a cap formation, the pyometer, meninges are involved, pus is there, purulent inflammation. Your answer will be very clear in your mind, that is a meningococcal meningitis caused by, yes, etiological factor is the, or etiological agent is the Neisseria meningitidis. Okay, fine, let's move on to the next question. Hereditary diseases. Okay, this you talk about in your genetics chapters and biology mainly, and you know this from your, I would say, childhood, not childhood, but from 10th 12th classes. So a macroscopic examination of 5-month-old baby who died of pneumonia has shown oblique slant of oblique slant of palpebral fissures, retraction of the dorsum of the nose, high palate, low location of the small auricles, a defect in the heart and the magistral vessels development, detected in autopsy. So a lot of hints are given over here. Genetic examination. So biggest hint over here which you could get over here, that's the 21st chromosomal trisomy. Okay, 27 chromosomal couple trisomy. So trisomy of 21st chromosome, that is the Down syndrome. Yes, this one I think everybody knows. So it's the Down syndrome, it's a trisomy 21st chromosome. What are the other signs which we need to look for? Because sometimes nowadays they're not giving you directly that there is a 21st chromosome trisomy, so they'll be giving the signs and then you need to identify the signs. So here are some signs which I have inserted over here for you guys so that you can recognize the situation. This is one of the commonest trisomy which is seen in the chromosomal abnormalities, okay, in the children's. And look at this one. So this is the trisomy of chromosome 21 Down syndrome. So look at the face of this unfortunate baby. First of all, trisomy of 21 chromosome will be there. Okay, they'll be having small ears, and auricles will be actually having the downward protrusion, so small ears. Even they have mentioned in the question itself that there is a low location of the small auricles, isn't it? Low location of the small auricles. Then they have mentioned about the high palate and the retraction of the dorsum of the nose. Okay, so brush field spots on the iris. There will be the apicanthal folds over here. Okay, apicanthal folds over here. IQ will be lesser, mental retardation will be seen over there. Dysmorphic round face, as you can see in the question itself. Macroglossia, bigger tongue they will be having. They will be having single palmar crease. Okay, and they'll be having the gaps in their fingers, so we are calling that a clinodactyly, gap between the first toe and the others one. So that is the central gap which we generally talk about, that central toe gap. Duodenal atresia can be there, so duodenal atresia, that is the radiological sign. Double bubble sign will be seen over there. Triple bubble sign you see in the iliac atresia, in the jejunal atresia, and multiple air fluid signs you will be seeing in the iliac atresia. Triple bubble sign you will be seeing in the jejunal atresia. Double bubble sign you will be seeing in the duodenal atresia, and the single bubble sign you will be seeing in the hypertrophic pyloric stenosis. Okay, if you can remember, very good, but if don't, that just let it be. Just remember double bubble sign, duodenal atresia, that is a radiological finding, actually can be seen in the Down syndrome. Respiratory infections can be there, obviously heart will be involved over here. Many kind of defects can be there. Septal defects can be seen in the heart. Cardiac defects, okay, in the 50% ventricular septal defect. PDA can be there, ASD can be there, so many kind of things are there. And thyroid problems, hypothyroidism can be there. Leukemia risk increases in these patients actually. Okay, then flat occiput. So these are the several findings which you can appreciate in the Down syndrome patient. Okay, so I would suggest you to go for the other anomalies also, for example to go for the Edward one mainly. Okay, so I'm writing it over here. So for you guys, the homework which I can say, that Edward syndrome, please look for the Edward syndrome. It's the trisomy of chromosome number 18. Look for the Patau syndrome, it is the trisomy of chromosome number 13. And please go through the Cry-Duchat syndrome also, it's the trisomy chromosome number 5. Okay, please go through them as well. And please go through the Klinefelter syndrome, which is the 47XXY. And please go through the Turner syndrome as well. This is the monosomy, yes, 45X0. Okay, please go through these as well for the better insight of these questions for the chromosomal abnormalities, because they are asking you on these 5 problems. Okay, and at last, if you have time, then you can read about the monosomy also. I'm talking about these are the defects, chromosomal defects. I want to suggest you to go for some signs also, so that you can recognize that they are talking about a Klinefelter or Turner, or these kind of things. For example, in the Turner, they'll be talking about the gonadotropin and all these things. Okay, so please go through them so that you are having a better insight for solving these chromosomal abnormalities problems. Okay, so with that said, guys, that was about the discussion of the pathomorphology series of this, I would say, ministry book. And I hope you enjoyed the discussion throughout the videos. And if you have liked the videos, please hit the like buttons, and make sure you subscribe the channel. So this was the last video of this playlist, and I'm very sure that you will be coming out with the flying colors very soon, and I wish you all the best for your exam. So thanks for watching this video, thanks for watching the whole playlist, and with that said, I will see you in my some other video, and please keep revising, keep studying, and all the very best once again. Thank you so much. Take care. Bye.